Graduation actually comes as a huge relief because you finally get to accomplish the 4 years that you just completed.
First, it was a relief. I was excited when we graduated, everyone was done the program and it was moving on to another phase of your life. But at the same time, it was a bit nerve-wracking, a bit stressful.
It felt great to graduate. It was one of my long-term dreams to become a nurse. Certainly it was very scary, frightened, going into the workplace, feeling that I wasn't prepared.
I was really excited to graduate, obviously. Like after 4 years of nursing school, I was ready to kind of start working. But I was really nervous, and like you don't really know how prepared you're going to be, like kind of when you're out on your own. Oh, I actually applied for the bursaries in my last year of nursing school. I had the interview for that and had an interview for a job at the same time. And after I finished my independent on Force SA, I got hired as a casual there.
I received my first job when I was a third-year student. My last rotation was in coronary care. That summer they were quite short of staff, and the manager asked could I stay on to work as a nursing student, of which I did. And then when September came, I was hired as full-time permanent right from my graduation. There's no classroom that can prepare you for what's ahead and for the experiences that you're going to face. The classroom is great for theory, and when you get out into the clinical area is when you will learn hands-on and with the people that are going to be co-signed with you.
So I kind of had to navigate on my own out there. It was a bit challenging, but I also wasn't there during a large hiring, so I can't really speak on their formal orientation, but that's all I got as I transferred out.
Once I started my orientation, I was paired up with a nurse, and she kind of mentored me through the whole process of starting my new job and starting to do things like all on my own.
The senior nurses and my mentors, the people that I was co-signed with, they certainly help you day by day, and they help you get through all the situations that certainly scare you and that you feel uncomfortable with.
Well, on my floor I found the staff really good. I love working with all the staff there, and I think they really helped the transition.
When you're doing your last independent rotation, you can't take verbals and stuff like that. So calling doctors and like, it was kind of a big deal, like taking orders for your patients. It was a bit nerve-wracking, like trying to get the doctor's name straight, who was who. Was it? Yeah, and it was a bit nerve-wracking going up to, you know, to the doctors and getting orders for that kind of stuff, yeah.
In the beginning, I remember time management being a big thing, trying to balance your time.
One of the big things I found was that in like clinical placements, I found that like my co-signed nurses would kind of do a lot of little things for me to, I guess, take some of the pressure off of me. But then once I was on my own, I wasn't used to doing all the small things like calling the doctor and stuff like that. So I found that transition kind of difficult.
So I remember going in being so scared because I was like, this is it, like I'm their nurse and there's no one else to, yeah. But the girls are there for you, like your staff is usually, you know, pretty good, and they're always there, like if you have any questions kind of thing.
It was a weekend shift, and there was no charge nurse because our senior nurse called in sick. So there was just myself and another girl in my class. So we flipped a coin to see which one of us would go in charge, and of course it ended up being me. And within 2 hours into that shift, one of our patients arrested, and we had to run a full code, fill out death certificates, a lot of stuff that we were not prepared and had never experienced before. It was quite a scary experience.
My first shift on my own was actually 2.5 weeks after I wrote the NCLEX. I had a funeral that I went to, and then I had to study for the 2 weeks. So my first shift back actually seemed like a big refresher. It turned out to be a Friday. It was on a heavy surgical floor. It was very busy, and at the end of the day I cried. It was hard, but I got up the next morning and went back in on Saturday.
Definitely at least a year, yeah. I think, before I was really comfortable. Yeah, like just because, like I said, it was casual starting off, so you're not there maybe full time some weeks, and sometimes you are. But yeah, definitely a year before I really started to kind of get my own routine down pat, and kind of getting really comfortable with like talking to patients, talking to the doctors, and started managing my time better at work, kind of thing.
I believe it takes at least 6 months to a year for any nurse to feel comfortable in where they work, because there is so much to learn, so much to be familiar with, and it just doesn't happen overnight. No one walks into a position and feels comfortable. It takes at least a year.
Don't be afraid to talk to your coworkers. Lots of times I called the floor or texted one of the staff coming in that I was comfortable with, hey, do you mind checking to see if I did so-and-so? Did I, make sure, did I sign off this? You come home and you think, oh my God, I didn't do this, I didn't do that. And most of the times you did do it. You just have to have that reassurance.
Ask questions, jump right in, get the most experience you can, and don't be afraid. We're all there as senior people. We're all there to help you and to help, become part of our team. And you will do a great job. It's a great career.
Soak up as much as you can during your independent placement, because that's when you're going to get the most of your experience, and when you know that you won't be alone during that time. So definitely try to learn as much as you can during that time, and just really try to learn from the other nurses, because they have a lot of experiences.
As you guys graduate and transition into your role as a registered nurse, I'd just like to pass along the message that you should be proud. You've accomplished a large program. Bachelor of Nursing just teaches you the bare minimum, and you have lots of options to explore at the end of the day. Look forward to your new options, your new endeavors, and enjoy your lifelong career.